Here's just some terms we need to go over real quick. So there's immunocompetent, hypersensitivity, immunodeficiency, and autoimmune. So when you're healthy and you have a good immune system that functions the way it's supposed to, that's just called immunocompetence. Okay, you ever heard someone's like, if they're competent at their job, it just means they're good at it. Right? So you're healthy, you got all your parts that work the way they're supposed to. Okay? A hypersensitivity, that's when your immune system is overreacting. Okay, so it treats something harmless as though it were something dangerous. Okay, so like pollen, for example, is a great example. Pollen doesn't hurt you. Okay, like it's not a bacteria, it's not a virus, it's not actually something dangerous. But some people are allergic to pollen, right? I have terrible pollen allergies and I want to claw my eyes out every spring. Okay, so that's an example of like your immune system overreacting, treating it like it's a harmful thing. Okay, same thing, people that have like peanut allergies. Peanuts are not harmful, right? They're meant to be eaten, it's food, right? But some people like are extremely allergic to peanuts, right? That's an example of a hypersensitivity. Does that make sense? So there are some things that happen when people have allergies. Some people break out in a rash, right? That's called hives. Okay, some people, their tongue swells up in their mouth. That's a pretty severe reaction. That's called angioedema. Okay, everybody heard of anaphylaxis?
Mm-hmm.
Who wants to tell me what that is?
Your throat closes up.
Your throat closes up. Mm-hmm. It's like you're basically trying to die about it. Okay, your body's like, oh my gosh, we're just shutting down, right? And that's, people use an EpiPen to help their body calm down. Okay, so hypersensitivities can range from mildly annoying to life-threatening. Okay, so some people's allergies are just, I have sniffles and itchy eyes. Some people are like, I will literally die if I don't have an EpiPen. Okay. Then there's immunodeficiencies. So this is the like exact opposite of that. It's where your immune system doesn't do anything, right? Like you don't have enough of an immune system to launch a protection against things that are harmful, right? So like AIDS is an example of this. AIDS stands for acquired immunodeficiency syndrome. Okay, so that means that like you don't have the necessary immune system to fight against germs, fight against bacteria and viruses to keep you from getting sick. Okay, any questions so far? Okay, and then autoimmune, the last one, this one is when your body, instead of reacting to foreign things that are outside of you, like pollen or peanuts or whatever, they start attacking itself, right? They for whatever reason, they get confused and they start attacking different parts of the body. And so we have lots of different autoimmune diseases depending on where the body's attacking itself. So if the body's attacking the stomach, if it's attacking the joints, those are different types of autoimmune diseases. Okay, does that make sense? Mm-hmm. Any questions so far? Okay. Just raise your hand, stop me if you do have a question, so I don't have to, always ask every time. All right, so as you're going through the book, you're going to notice that there's a lot more in the book than what I actually teach. So if you come across a condition in the book that isn't in the PowerPoint, just skip it, okay? Because I'm just teaching like the most common ones. As I was reading through the chapter, there was stuff in there that I've never even heard of. And I'm like, I'm a nurse practitioner. Okay, so like the likelihood of you having to know about that is slim, right? So if I just focused on like the ones that I feel like you needed to know. So there's big chunks that you can just skip through if it's not on the PowerPoint, okay? Just don't read those. This is the list of conditions we will be going over and that you will be expected to know. If it's not on this list, don't worry about it, okay? All right, we'll start with AIDS. Kind of talked about it just a little bit ago. It's an immunodeficiency problem, right? So you don't have the adequate immune system to fight infection. Who can tell me what etiology means? Who did their homework? Hey.
It's the origin?
Yeah, the origin or the cause, right? So like what's causing this disease? Okay, so the etiology. People with AIDS, they get AIDS from being infected with HIV. People tend to use HIV and AIDS interchangeably, but that's technically incorrect. HIV is the virus, okay? It stands for human immunodeficiency virus. So when people get infected with that virus, it eventually leads to AIDS, the disease, okay? So HIV is the virus, AIDS is the disease. What's happening is that what makes this so bad is that this virus, instead of like attacking like the lungs, which makes you get like a respiratory infection, or attacking the bowels and you get diarrhea, this virus attacks the immune system itself, which is really bad because if a virus is attacking the immune system itself, the immune system is weakened so it can't fight it. Does that make sense? Mm-hmm. So it's like a really, really deadly virus because it's attacking your own defenses, if that makes sense. Specifically, there's the cells called the helper T cells. They're also called the CD4 cells. A lot of times in medical terminology, there's multiple names for the same thing, which is really annoying because you think they're like talking about 5 different things, but it's the same thing. So if you see helper T cells or CD4 cells, it's the same thing. It's just a type of white blood cell. Okay, I don't know if some of you have taken A&P before, but they go into all this detail about like all the different types of white blood cells. There's more than one. Okay, there's like a bunch of different types of white blood cells. This is one of those types. Okay, so that's all you really need to know. And who knows what a white blood cell does?
They are like the fighter.
Yeah, they're kind of, when you play the game Pac-Man, you know how the Pac-Man like eats up the dots? That's essentially what a white blood cell does. It goes around eating up all the viruses and bacteria. Okay, so if the viruses are attacking those guys, you can imagine that's going to become a problem real quick because there's not going to be enough Pac-Man around to eat up the germs. So then the germs just keep multiplying, and you're just sick all the time. Does that make sense? All right, so symptoms with this is it kind of starts off slow, right? Because it doesn't wipe out your whole immune system right away. It's like a slow process, right? Because your immune system is still trying to fight back, right? So it starts with kind of vague flu-like symptoms where you just kind of feel ill, like kind of like when you're just starting to get sick with something, right? Your immune system's fighting something. Later on, as the disease progresses, you start getting what's called opportunistic infections. The reason it's called opportunistic is because most healthy people don't get these. Okay, like the person who has an immunocompetent immune system, they're not going to get these diseases. So when people get certain diseases that are opportunistic, we know something's going on because most people's immune system should be able to protect against these. They're called opportunistic because they jumping on the opportunity of your immune system being weakened. Does that make sense? So there's things like Kaposi sarcoma, which is a kind of cancer, which is a kind of it doesn't necessarily mean you definitely have AIDS, but it's like questioning like, hey, why do you have this? Most people who have good immune systems don't get this. Okay, so it's kind of like makes you think maybe this person has AIDS. Candida albicans is another one. This is also called oral thrush. It's where you have like the fungal growth in your mouth. Most people don't get that, even if they are sick, right? So if you have this, it's kind of pointing to the fact that your immune system isn't working right. Okay, a formal diagnosis of AIDS is when your CD4 count, remember that's those helper T cells, when they drop below 200, you officially have considered the diagnosis of AIDS, right? That your immune system has been impacted to such an extent now that it's a problem, okay? There are also other tests called the ELISA test and the Western blot. You don't need to know how these work. You just need to know that they're associated with AIDS, right? So if you're reading through a chart and you see that someone's gotten the Western blot and it's positive, or the ELISA and it's positive, that tells you that it's diagnostic for AIDS, okay? You don't need to know how to do the test or anything else about the test. You guys aren't trying to be nurses or doctors, okay? I'm trying to keep it simple, all right? So don't worry about learning how to do all that stuff. Like, unless I tell you that it's important, don't worry about it. Treatment for AIDS, there's something called HAART, which is, what does it stand for? Something highly active antiretroviral therapy or something like that. You don't necessarily need to memorize what it stands for, but basically they take bunches of different antiviral medications in a cocktail to try and fight off the disease and keep their immune system functioning. Okay, so if you see HAART anywhere, just know it's like a bunch of antivirals. So ART is antiretroviral therapy to keep these people from being super sick. There's also something called PrEP. You might have seen commercials for this, like the happy people like skipping and smiling.
Yes.
Is that a preventative though?
Yes, so PrEP is for people that don't have AIDS but are engaging in high-risk behaviors. Like specifically men who have sex with men is a high-risk behavior. So like if you have a partner that has AIDS and you don't want to get it, you can take PrEP, which helps like prevent you from getting it. Okay, so that's another just thing to like look out for if you see that. Prognosis. Who knows what prognosis means?
It's like kind of like your signs and symptoms, kind of like.
Not.
Yeah.
Who said?
Outlook.
Yeah. So it's like, what's likely going to happen here? Like, if someone says, "What's the prognosis for a cold?" I'll be like, "You'll get over it in a week and you'll be fine." Right. So it's like, what's the most likely outcome of this disease? Right. So AIDS prognosis, there is no cure. Right. It's not like we can give you an antibiotic and you'll be better. Right. You'll have this forever. But it's gotten a lot better now. We have a lot of medications and things to keep people living almost with, no problems. right? So fortunately we have really good medications now. So the prognosis is manageable if people are really good about taking their meds and being careful. If you're not, and you're just not taking your medications and acting crazy, then it's probably not going to work out super well for you, okay? So this is one of those diseases that you don't want to play around with if you have it, okay? Any question on AIDS? All right, now we've got pernicious anemia. This is an autoimmune disease. Okay, so AIDS was the only one of the immunodeficiency diseases we're going to bother talking about. Moving on to the rest of these on this list are going to be all autoimmune. Autoimmune diseases are becoming very, very common where the body's attacking itself. And I will just say, more women than men have autoimmune diseases. And I like to think it's because women are really hard on themselves. Their body's literally attacking themselves, okay? So there are some men that get them too, but like more often than not, it's more common in women. So etiology, the cause, what's causing this disease? So antibodies, do we know what antibodies are? What's an antibody? Who's done the homework?
Oh, gosh.
And this is why I usually have this homework due before class so that you know what these terms are. Yeah.
Okay, so I haven't done the homework yet, but can I take a guess?
Yeah.
So an antibody is like, can I use an example?
Yeah.
So like when you get a flu shot, they're giving you antibodies so that your body can fight it off. That way,
Yeah.
if you're exposed to it later, you have the antibodies to fight it off.
Exactly. So part of the function of the immune system is to create antibodies, right? And they're like specific fighters that fight against specific diseases, right? So that's one of the reasons why AIDS is so bad, because it targets those CD4 cells, right? And CD4 cells help create antibodies, right? So if you can't create antibodies, you can't really fight diseases. So with autoimmune diseases, the antibodies that are being produced are attacking itself for some reason instead of outside invaders. They get confused and they're just like, I don't like the way my stomach looks, I'm going to attack it. Okay, it's weird. So that's what this is, chronic gastritis. And gastritis, itis means inflammation, and gastro is referring to the stomach. So chronic inflammation of the stomach from autoantibodies attacking itself eventually causes the stomach to not be able to absorb B12 anymore. Okay, like the stomach is so inflamed. Normally that's where you absorb B12, you know, like you eat it in vitamins or in food or whatever. You ever heard people with vitamin B12 deficiencies because they don't absorb it? They could have pernicious anemia, maybe, but not necessarily. Basically, they can't absorb B12 through their stomach because their body's attacking the stomach. And then without B12, they can't make red blood cells. B12 is an important building block to creating red blood cells. So a lot of people who can't absorb B12, they often feel very tired and weak because they have a form of anemia. Does that make sense? So symptoms of this are going to have 3 different main side effects. So the first one is going to be digestive issues, right? And that's because the body's attacking itself in the stomach, right? So you're going to have like nausea, vomiting, maybe some diarrhea because your body's literally attacking the stomach. Okay, the second one, and that's what NVD is, nausea, vomiting, diarrhea. The second one is going to be symptoms from B12 deficiency, and B12 is one of those vitamins that helps with the nerves, so people will have like some weird numbness and tingling when they're really, really deficient in B12. And then the third one will be related to symptoms of anemia, again, because without B12, your body literally can't create more red blood cells. It's like you can't bake a cake without flour. Right? So it's like if you don't have the flour, you're not going to be able to make a cake. And so when people have anemia, they feel really weak, lightheaded, they get pale, that sort of stuff. So all 3 of these different kinds of symptoms are common in pernicious anemia. Okay? How do we diagnose this? And this is, all these lab things are in the resources tabs. You should go check those out. I have documents on knowing what different labs are for, so when you're reading through charts, you'll know what it is, and it's in common language, so it should be easy to understand. So HGB is hemoglobin, RBC is red blood cells, and this just refers to like the anemia, right? So their blood levels will be low because they're not able to make those red blood cells. They will have low B12, obviously because their stomach can't absorb it. They will have the presence of antibodies attacking itself, and that will be true for every autoimmune disease. They'll have the presence of autoantibodies. Okay. Treatments. people need to get injections of B12 basically for the rest of their life. Okay, and why do you think they need an injection of B12? Anybody have a stab at it?
Because they can't make it, so.
Well, they can't absorb it,
Or
right?
can
They can't absorb it in their
get
stomach,
rid
which
of
is how most people get
Get
it.
it.
So when you get a shot of B12, it
Goes down.
it skips the stomach, right? It just goes directly into you without your stomach having to absorb it. So anybody ever gotten a B12 shot?
Yeah.
Yeah. So that's like the best way to do it because your stomach obviously can't absorb it. So this way it's just going straight into you. And these people have to get B12 injections like every, couple months for the rest of their life. Okay, so if you see on someone's chart that they're like constantly getting B12 shots, that can help support a diagnosis of pernicious anemia. Does that make sense? Prognosis of this is chronic, as all autoimmune deficiencies are. We don't have cures for autoimmune diseases. We don't know really why they happen or what causes it. We don't know how to stop it. We have medications that can help mitigate some of the symptoms, but like it's a chronic disease. All autoimmune diseases are pretty much chronic diseases. Does that make sense? Any questions about this one? If I lose you, tell me, okay? I'm trying to keep it simple, but I know sometimes things can get a little weedy. All right, this is a mouthful. Idiopathic thrombocytopenia. All right, let's break this down. Idiopathic, this just means we don't know why. Okay, that's literally the science word for we don't know why this happens. Okay, and then thrombocytopenia, let's break this down. A thrombocyte, anybody know what a thrombocyte is? This is in your homework. A thrombocyte is a platelet. Anybody know what platelets are? The things in your blood that help you clot. Okay, so in your blood you have three things. You have red blood cells, white blood cells, and platelets. Does this sound familiar to anybody?
Mm-hmm.
Red blood cells are your actual blood. It's the red stuff. The white blood cells are the ones that fight the infections, like little Pac-Mans. And then the platelets are what help you to not bleed out. So like when you get a cut and it makes a scab and it stops bleeding, those are platelets. Okay, so thrombocyte is the medical term for platelets. And then penia, stop that. Penia just means a low number of. So thrombocytopenia means a low number of platelets, and we don't know why. Okay, so that's what that disease is. We don't know why this person doesn't have enough platelets. Okay, this is why medical terminology is really important, because you could look at that and be like, I have no idea what in the world is it talking about. But if you can break down the suffixes and prefixes to know what they're meaning, then you can break down, okay, I can figure out what this disease is. All right? So etiology, I basically just said it, unknown platelet deficiency. And you'll kind of know also because the white blood cells and red blood cells, those are normal. So it's literally just the platelets that are being affected. Okay? Symptoms of this, you can probably figure it out. If you don't have enough platelets, you're going to have clotting issues, right? So you're going to be bleeding more. Does that make sense?
Yeah.
So there's something called petechiae, ecchymoses, epistaxis. These are medical terms. Any of these sound familiar to anyone?
The hematuria.
Yeah, that's
hematuria.
Huh? You said hematuria?
Yeah.
What's that?
That's the blood something.
Heme means blood.
Yeah.
So anytime you see heme, that's blood. Urea is urine. So bloody urine.
That's it.
Okay?
Yeah.
So you'll see like kind of a red tinge in your urine, which for women they might not even notice because people have periods, right? But like
Right.
so they might not even realize that. Petechiae, these are like little pinpoint like red spots.
Oh yeah.
Yeah.
I took medical term last
Yeah.
time.
I know, like-
Yes. I've been read, yeah.
Ecchymosis, this is what I have on my face right now. Okay, ecchymosis is just a fancy word for bruising. Okay, you'll see a lot of old ladies who got bruises everywhere because your platelets kind of start to get not that great when you get older, just like everything doesn't get that great when you get older. But bruising is ecchymosis, and epistaxis is nosebleeds. So just like their nose just bleeds. So a lot of bleeding issues, clotting issues because you don't have enough platelets. Okay, how do we diagnose this? There's a lab called a CBC, which is called a complete blood count. So they're literally counting the number of things in your blood, okay? And again, when you do a complete blood count, you'll see that the platelets are low, but the white blood cells and red blood cells will be normal, okay? So that helps you figure out that it's just the platelets, okay? And again, I recommend you go check out that lab tests document that I made under the resources tab because you'll need that for this entire class. And if you don't know what a certain lab is, you'll need to know that. Be like, okay, I see that someone got a CBC and then platelets are low. That helps support this diagnosis. Does that make sense?
Mm-hmm.
Okay. Prognosis. What's the outlook for this? Again, this is going to be chronic in adults, but for some reason we don't really understand why children. Sometimes for them it's acute. Anybody know what the difference between acute and chronic is?
Acute is like more severe.
It's severe, but it gets over. They get over it, right? They get sick with it and then they recover. Whereas chronic is like you're sick with it just indefinitely, right? So we don't really understand why, but it's less bad in children. Okay. Any questions? Right. All right. Now we've got immune neutropenia, and I'm going to try to just go a little bit quicker, so make sure we can get through everything in here today. Immune neutropenia. Again, neutro is referring to a neutrophil, okay, which is a type of white blood cell. So what is neutropenia? Right, a low number of this particular white blood cell. Neutrophils are white blood cells. So a low number of white blood cells because the body is attacking itself there. So with the AIDS virus, you've got the AIDS is attacking the immune system. With this one, your own body is attacking your own immune system. So it's basically kind of like AIDS without having AIDS, if that makes sense.
Wow.
It's like the autoimmune version of AIDS.
Right.
So with symptoms of this, it's going to be very similar to like AIDS symptoms, right? Because you're going to have kind of generic blah feelings. You're going to feel tired. Malaise is just kind of general blah, right? That's literally the medical term for I just don't feel good. Having some fevers, getting sick a lot. That's recurrent infections, especially like respiratory and ear infections. So like constantly getting colds or flus or earaches. That's kind of like your immune system just isn't working well, okay? Because you don't have enough white blood cells. Again, diagnosis for this is going to be a CBC, a complete blood count. So they're going to count and see how many white blood cells you have and be like, yep, they're low. And again, presence of anti-neutrophil antibodies. And again, that's true for all autoimmune diseases. There's going to be anti-whatever antibodies. They're just attacking yourself. How do we treat this? There are corticosteroids. And if you see corticosteroids or steroids, it's the same thing. Okay? Don't get confused. It's not two different things. It's just people call them corticosteroids or steroids. The purpose of steroids is to help decrease the immune system. Okay, and you might think, wait, why are you wanting to decrease the immune system here because the immune system's already being attacked? Well, it's trying to decrease the autoimmune system attacking the immune system, if that makes sense. It kind of gets messy. But you're trying to tell your body to calm down. It's kind of like a hypersensitivity. It's overreacting and attacking things it shouldn't. So we're trying to get the immune system to like chill out so that we can like have neutrophils that work. Okay? And then this is, you don't need to know all about all this, but basically hematopoietic, heme, that has to do with blood, right?
Mm-hmm.
And then growth factor. So they're basically trying to make your body grow more white blood cells in your blood. Okay, so if you just see that, as a treatment somewhere, you can be like, okay, we want something to grow in the blood. We want some more white blood cells. Get your body, because your bone marrow is what produces this stuff, right? So it's basically telling the bone marrow, please produce more because we don't have enough, all right? And then prognosis, in adults, it's, chronic, but in infants, again, usually they get it and then they just figure it out and get better. They just resolve spontaneously. So, yay for children, I guess.
Mm-hmm. Could it be because they're still like growing and things are still trying to?
Probably. I mean, there's a lot we don't know about autoimmune diseases. I'm not gonna lie, I don't know why. It's just, for some reason, kids tend to have a better time with it.
And I mean, not to get off subject, but working at Cigna, that in the pharmacy, that's all I see is autoimmune drugs. That's all I see.
It's getting worse and worse.
There's so many IVIG. It's
Yeah.
crazy.
Do we know why it's getting worse?
I mean, there's lots of theories, but I don't know. Nobody agrees. If you ask this specialist, he'll say it's because of the food that we eat. Someone else will say it's because of this, and who really knows?
Right.
We just
Uh-huh.
live in a messed up world. I don't know what to tell you. All right, you all have probably heard of lupus before.
Yeah.
This is the full name: systemic lupus erythematosus. Systemic is just because it affects your whole body, right? If you see systemic, that means body-wide. The opposite of that is localized. So if you say localized, that means it's affecting like one area, like maybe just your knee or just your arm. Systemic means body-wide. Lupus is just the name of it. And then erythematosus. So erythema means redness, right? And that the technical name for a red blood cell is an erythrocyte. Okay, so that's where you get the red from. And basically, it's called redness because a lot of the times people with lupus have really red skin. Okay, so that's where they get that from. All right, with this one, the cause is that the autoantibodies, instead of attacking the stomach, like in pernicious anemia, these antibodies are attacking connective tissue. And connective tissue is everywhere in your whole body, right? So that's why this is a systemic disease, because you have connective tissue in your entire body. So symptoms, there's like a crap ton of symptoms because you have a lot of connective tissue everywhere in your body, but there's like main ones, like the butterfly rash. This is like a hallmark sign. Like this is like one of those like classic indicators of lupus, and that's where you have like this rash that goes across your cheeks, over your nose, and down to the other cheek. It kind of looks like a butterfly, like if your nose was like the worm part. I don't know what you call it.
Their body.
Yeah, the body, and then this is like the wings. They call that the butterfly rash. Okay. So people who break out in that, that's like, that's pretty concerning for lupus. Photosensitivity. Anybody know what this means? Have you heard of this before? Yeah, so you're sensitive to sunlight. Some people get this with certain antibiotics can cause photosensitivity. I don't know if you ever like heard that from a pharmacist. But basically, like you just get you get sunburned real easy, real irritated to sunlight. And they turn really red, which is why you have the erythema in the name. Okay. Joint pain, and that's again because your connective tissues are like a lot of it's in your joints, right? And so like people with lupus have real bad joint pain. Body-wide symptoms, again, there's a bunch more listed in the textbook, but I can't list them all in here. It's a kind of a hard disease to diagnose at first because it's just there's so many symptoms and not everybody has all of them. So it's like, I don't know what you have, right? Treatment for this, anti-inflammatory drugs, it's going to just help bring down that inflammation because the inflammation is what's causing the pain, right? When the antibodies are attacking your body, it creates an inflammation response, right? So that's why everything hurts. So those drugs, steroids, again, that's going to help calm down your immune system so it stops fighting you so hard. And then there's also drugs called biologics or DMARDs. If you ever see these, those are also very common for treating autoimmune diseases.
We be reading these questions, we have to do the criteria questions. And I be like, have to ask them, and they be like, what is that? And I be like, pharmacist.
Yeah.
I would tell them that, but
Yeah, lupus is kind of a hard one because it manifests in so many different ways because it's literally your whole body. So it's kind of a difficult one to diagnose. All right, and then prognosis, again, this is a chronic condition. You can't cure it. You just have to manage it with meds. People do tend to get flare-ups, like with triggers, right? So some people like, oh, my lupus symptoms get worse when I go in the cold. All right, well, try to bundle up and, have a heating pad or whatever. Or some people are like, oh, my lupus gets worse in the heat. I don't know. It's just that everyone has triggers. So you try to mitigate those triggers and, keep your meds. But there's no cure, okay? There's no cure for any of these diseases that we're talking about today, unfortunately. All right, scleroderma. Anybody know what the root derm means? Skin. So this is talking about the skin. And then sclero refers to scarring. Okay, it kind of sounds like the word scarring. So it's scarring of the skin. Okay, so cause of this is that for whatever reason, the scar tissue, if you're, like your body creates scar tissue, like when you get a cut, right? But your immune system the antibodies are attacking that area so that you're constantly producing scar tissue where you shouldn't be. So it causes like your skin and your internal organs to start getting scars all over it and getting hard, and it's very bizarre. There's some pictures in the book. Basically, like your hands start like curling in and like getting like scar tissue around them, and it's like you start losing range of motion in your hands. And hands are like one of the most obvious. Hands and face are kind of the most obvious places to see it first, but there also can be hardening of the organs inside too.
I was gonna say, is that like That's sarcoidosis of the lungs? Is
Yeah,
that
similar,
like that?
yeah.
Okay.
Yeah, some of these are really not great to have. So symptoms obviously is like you start getting really tough and leathery skin. It's kind of itchy, and sometimes there's like pigmented patches. Like because scar tissue is like a different color from your regular skin. With diagnosis, I mean most of it is based off of like the presentation. Be like, hey, your face and hands looks this way, right? So symptoms and like assessment is a big part of the diagnosis. Ruling out other things, right? Just trying to figure out like, is this really scleroderma or something else going on? Diagnosing all autoimmune diseases, you have to rule out just because if people have one autoimmune disease, they're more likely to also have multiple. Like for some reason, like they tend to go together. Treatment for this, again, palliative. When you hear the word palliative, that just means managing symptoms. Okay, it doesn't necessarily mean the person's dying, like
Right.
palliative care.
Right.
Palliative just means we're going to make you comfortable and manage your symptoms, right? That it means that we're not trying to cure you because there is no cure.
Right.
Okay, so that's just what palliative means, that we're trying to make you feel better. So PT, that's physical therapy, so trying to keep that range of motion, because you know how like scar tissue, like it can, affect, like if you ever notice, like if you've got a big scar in your skin, like it doesn't have the same elasticity, right? But if you kind of like are constantly moving it and like trying to keep it loose, it helps a little bit regain some range of motion. And then again, steroids. Steroids are going to be kind of a main treatment for everything with an autoimmune, right? Because again, it's your immune system attacking itself, right? And the purpose of steroids is to calm down the immune system, right? So that keeps your immune system from unnecessarily attacking you as much as possible. The downside, anybody think of what a downside would be to being on steroids kind of for a long time?
Well, I know people gain a lot of weight.
That's fair. That wasn't what I was thinking of.
Oh, you end up needing more.
Huh?
You end up needing more probably.
Not necessarily, but think if you're constantly like keeping your immune system weakened, that's going to make you more susceptible to getting sick, right? So it's like the problem is that you have an immune system that's attacking you, and we don't want that. Like I don't want my immune system to attack me. I need me, right? But like if you're taking medications to keep your immune system down, that means you're more likely to get sick with stuff if you get exposed to it, right? So if you're around people that are sick, you're more likely to get sick because your immune system is like literally being leashed. Does that make sense?
Yeah.
So we try not to keep people on steroids indefinitely because that's just asking them to get really sick, right? So typically they put people on steroids for a short time, like in the middle of a flare-up to help them get through the symptoms. Does that make sense? But generally, unless it's like really, really bad, we try not to have people on steroids for very long, just because that's putting them at risk for getting something serious.
Is that like,
We'll get to it. I've got
okay.
medications coming up at the end.
Okay. I'm sorry.
No, you're good.
I'm jumping.
You're fine. Yeah, prognosis, this is again chronic, pretty much every one of them is. And progressive, that means it like will continue to get worse. Okay? So progressive means that the disease is progressing. Like it will get worse, but like obviously medications can help keep the progression slower. Okay? Alright, this is a weird word. It's pronounced Sjogren. I don't know how they get show from SJ, but that's what it is. Sjogren syndrome. What's causing this one is that the immune system is attacking moisture secreting glands. Okay, so like saliva, your salivary glands, your tear producing glands. So that just leads to a lot of dryness. Okay, so these moisture glands aren't able to produce the moisture that you need, so you're just very dry eye, dry mouth. Okay, this is one of those terms, xerostomia. This means dry mouth. Okay, whenever you see xero or whatever, that's going to be dryness. Okay, now think about it. If you have a constantly dry mouth, your mouth is supposed to be wet, right? That's how it protects itself. A lot of these people have really bad mouth sores because their mouth is just so dry, which leads to a lot of tooth decay as well. Like your mouth is supposed to be wet. The saliva actually has good things in it to keep your mouth healthy. So without that, like your teeth can start to rot, get sores in your mouth. Dry eye, and again with dry eye, you can get like cornea abrasions and things like that. So the treatment for this is really just to replace the moisture. Okay, so like eye drops, and they even have like artificial saliva, which sounds absolutely disgusting to me. Like you're gonna put fake saliva in your mouth, but okay, like that makes me want to gag a little bit. Like, oh no, thank you. But I mean, I guess you kind of have to if you don't want all this other stuff. Yeah. So diagnosis, one of the main things that you're gonna check first is to make sure that you're not just experiencing a medication side effect. Because there are a lot of medications that you can be on with a side effect of dryness, right? Like that's a very common side effect, like dry eye, dry mouth. A lot of people quit taking their medicines because it causes that, and they're like, I hate this side effect, I can't deal with it. So first thing the doctor is going to do is going to be like, hey, let's look at the meds you're taking to make sure it's not just one of those. Okay, so it's kind of ruling out stuff, and if they've ruled out everything else, they're like, there's nothing that should be causing this, they're probably going to say you have Sjogren's syndrome. When they do labs on you, like blood work, they're going to notice that there's elevated ESR. ESR is just a marker for inflammation, and that's in the lab test sheet. Pretty much with every autoimmune disease, you're probably going to have an elevated ESR, which just means that there's chronic inflammation in your body. Okay. There is something called the Schirmer tear test. This is, again, just testing to see like if they can get tears to be produced. And people who have this disease can't because those moisture secreting glands like can't, right? So if you see Schirmer tear test and it's positive, that indicates that it's helpful to diagnose for this disease. Okay. I talked about treatment. Chewing gum actually helps to stimulate. Have you ever noticed that when you chew gum, you kind of tend to make more saliva? That's one of those things. And again, prognosis is the same, chronic, and just manage symptoms with medications and stuff. You should be noticing a pattern with a lot of this. A lot of it is the same. You guys doing okay? Any eyes glazing over? Okay. I know it's like a lot, especially for those who haven't taken A&P or MedTerm, or if it's been a while since you've taken those, it can be like, oh God, what are we talking about? So I've tried to help break down a lot of the stuff in those resources tab as a refresher if it's been a while or if you've never taken those classes, okay? All right, rheumatoid arthritis, or a lot of people just know it as RA. This is a pretty common one. Most people have probably heard of this. Most people know it's like people with the gnarled fingers and the hands, right? Okay. So again, for this one, the body's attacking the joints. Okay, so you can have RA in any joint, theoretically. For some reason, the hands tend to be really common. You can also get them in the toes and the knees, but like hands tend to be like the most commonplace. So obviously, symptoms of that are going to be very severe joint pain, stiffness, especially in the morning. Like people wake up in the morning and they're like super stiff until they start getting moving. People find that when they start getting moving a little bit, it gets a little bit better, and that's indicative of rheumatoid arthritis. Eventually the inflammation will get so bad that it like permanently deforms the joints, right? You'll start seeing people's like fingers, facing this direction and like their knuckles being huge. You know what I'm talking about? Anybody seen that before? Yeah.
My great-grandmother.
Yeah.
Her fingers were so like crooked like that.
Yeah.
All, especially probably a little before she passed away, but she couldn't even hold anything, and her toes were the same way.
Yeah, it can be really debilitating because like you need your hands
And her knees,
for a lot of things,
yeah,
right?
Her knees would be
Huge. Yeah.
Yeah.
Yeah. Did she not ever take
I don't
anything?
think back then.
Probably not.
They didn't have medication.
Yeah.
back then.
We've got a lot of new stuff
Yeah,
now that
I
we
know
didn't have back then.
They knew she had it.
Yeah.
Because it's running in the family, not the rheumatoid. We have what they call the osteoarthritis.
Yeah.
But
So the difference between osteoarthritis and rheumatoid arthritis is that one is your immune system attacking itself, which is the RA. The osteoarthritis is just from wear and tear.
wear and
So
tear.
like you've just been using your joints a lot.
Yeah, I started out, I was scared because I was the same way. I wake up, I couldn't even move my hands.
Yeah.
And I'd have to just put them under hot water and
Mhm.
soak them, trying to get them to move. So I finally went to the doctor and I told him, I said, we have rheumatoid arthritis.
In your
It runs
family?
In the family.
Yeah. Do they test you for it?
Yeah, well, they did, and I tested positive. My is it the ANA? My
Uh-huh.
ANA was elevated, but I guess that must have a different test. Or something, because-
They'll always test for autoimmune antibodies, right?
And see, I have it because I was on Celebrex, and then Celebrex got to where it wasn't working, so then Oxycam, and I quit taking it. I started taking this other stuff.
And I imagine your job doesn't help because you're
No,
doing a lot.
Yeah.
All right, so with diagnosis, you kind of talked about this a little bit. Ruling out SLE, which is the one we talked about, systemic lupus erythematosus, because remember joint pain was a big part of the symptoms for lupus. So they're going to try and rule out lupus and other autoimmune diseases. Pretty much they screen you for a lot of them because, like I said, if you have one, you tend to have more than one. They'll just kind of watch and see like, oh, hey, your hands looked like this a year ago and now they look like this. So that's kind of indicative that you have this. They'll do labs. Again, they'll look at, various things. Again, there's no cure. The goal of treatment is just to keep inflammation down so that the pain is manageable and it helps preserve the joint function. So the inflammation is what's actually like causing the damage to the joints, right? Like chronic inflammation always leads to deformity, right? So if you can keep the inflammation down, the body won't cause as much deformity. Once you like have the deformity, you can't go back, right? Like it can't be restored to how it was, but you can help slow down the deformity, if that makes sense. So common meds, aspirin, NSAIDs, things to kind of keep it from progressing as much. And then again, prognosis is chronic, and again, affects more women than men, and that's true for pretty much everything. Now, this is the only one that's actually the opposite, okay? So like, women are most likely to have most autoimmune diseases except for this one. For whatever reason, men have this one more than women, and it's ankylosing spondylitis. That's another fun name, ankylosing spondylitis. Again, itis gives it away that it's inflammation of something. So what's causing this is that it's inflammation of the spine, okay? So it specifically targets the spine, whereas like with RA and lupus, it can affect any joint, right? This one, for whatever reason, just like, we want to attack the spine today. That sounds like a good idea. I don't know. So morning low back pain is is a very strong indicator. Pain and tenderness in that area as well. Starting to realize you have limited range of motion, like you can't stretch as much, you can't lean as much. Forward flexion, that just means that you're starting to like lean, like, you ever seen those little old ladies that have like the hump? It's like the same idea, but it's not necessarily ankylosing spondylitis, but it's the same idea. They start having like this hunched appearance because their spine just starts to get deformed, right? So their top part of their back just starts to like go like this. So you see like a man like this, that's probably ankylosing spondylitis, okay? Diagnosis, so again, they're always gonna look for those antibodies in the bloodstream. This is the specific one for ankylosing spondylitis. So if you just see that, you'll be like, okay, that's related to ankylosing spondylitis. You don't need to know what all this means or anything, but just like, you'll know that if you look through a chart and you see that pop up, like the HLA-B27 antigen, I know it's like a bunch of random letters and numbers, but you just get used to it. You'll be like, okay, that's to help support a diagnosis of ankylosing spondylitis. Does that make sense? Because it wasn't, when you do coding, you're trying to find things that support a diagnosis, okay? So you can look, anything can help support a diagnosis, whether an assessment finding, a symptom, a medication they're taking, a test that they got, like a lab result, right? And that all can help support the fact that, yes, they definitely have this diagnosis, here it is, reimburse them for this, okay? Again, there's no cure, we're just trying to make them feel better. Typically affects men, chronic and progressive, okay. I think we're almost done. Got just a few more. Okay. Doing good on time. All right, multiple sclerosis. Anybody remember what scler was from before? Like the scleroderma? Scarring. Okay, so this is scarring of the neurons. Anybody know what neurons are? What are they?
What sends signals to your muscle?
So they're basically what your brain is made of. Okay, so like, you've got, everything is made up of cells, right? So you got skin cells, your stomach is made up of cells, your muscles are made up of cells, right? Your brain is made up of cells. The name for the cells of the brain are neurons, okay? So what's happening here is that your immune system is attacking those neurons. I'm gonna draw a picture just so you can see what I'm talking about. So they're shaped kind of funny. They literally look like this. Does look familiar to anyone from A&P?
Don't know.
Huh?
Yep.
Yeah. So this is just so you can understand what's happening. You don't need to memorize this. But this is what a neuron looks like, more or less. I'm not an artist, I'm sorry, okay? This is where the nucleus is. You remember the nucleus, like the brain of the cell? And then they have this little tail, which is called the axon, okay? So the neurons, they go somewhere, right? So you know how you get your muscles to move? Like you think, I'm gonna move my arm, and it moves, right? Like that neuron, this part is in your brain, and then the axons come all the way down and go to that muscle. So like this is the muscle, does that make sense? So like this is obviously gonna be really long, going from here all the way down. So like it connects to the muscle. So when your neurons are being attacked, these don't work as well, and the signal that gets sent down here, like your thought signal going down here, doesn't reach the muscle. So you're like, move my arm, and you're like, eh. Rather than, does that make sense? That's kind of confusing. But this thing's called the axon. This, like, these little squares is just a protective coating to keep it from getting damaged. That's called the myelin sheath. Okay, the myelin sheath is the protective coating on that axon to keep it from getting broken, because nerves are very sensitive. If you slice a nerve, you don't ever get that back, right? If like this were to be severed, when you get paralyzed, like now the connection between your brain and muscle is gone, and you can't move that anymore. That's paralysis, right? You either sever a nerve, like you just don't have healing there anymore. I had surgery on my wrist, and they cut a nerve, so now like I have permanent numbness right here, like in this one little patch of my skin, because the nerve that went to that part of my skin got cut in the surgery, so now I just don't feel anything. Like it's completely numb. Yeah.
My mom caught on fire and she doesn't have nerves and where she got burned.
Yeah, they probably burned off. Like that's terrible.
Yeah, my grandpa's suffering from myelomalacia.
What now?
Child, his spine, his nerve and his spine is deteriorating.
That's-
Myelomalacia.
Yeah.
M-Y-E-L-O.
That's okay. We don't need to know that for this
Yeah.
class.
I was like, what is that? When he told me that.
But did this make sense? I know my drawing isn't the best, but basically what's happening is your immune system is attacking the myelin sheath, okay, that little protective coating, which makes the nerves not protected, okay? Like it's like taking off like the bubble wrap, all right, of the nerve. So what happens here is that you start having nerve issues, so sensory and motor problems, okay, because nerves do both, right? Nerves are what tell your muscles to move, that's motor, but nerves also receive sensation, right? So that's why I said, like, I don't have any sensation on this part of my hand. Thankfully, I can still move it, right? But like, whatever part of the sensory nerve, that was broken, okay? So people with multiple sclerosis will start having sensory and motor problems, okay? Because their nerves that do the sensory and motor are starting to get fragile and messed up, okay? So some kind of symptoms would be like numbness, tingling, unsteady gait. Unsteady gait is just walking funny, okay? So like the nerves involved in telling your muscles to move and your legs are just kind of wonky and you kind of are unbalanced. Speech issues, so like your tongue doesn't move the way it's supposed to. Vision issues, right? So there's like a long list of symptoms you can have because there's a lot of different sensory and motor things. I'm just kind of listing like the most obvious and common stuff, okay? So basically anything that involves movement or sensory can be affected. Okay, does that make sense? Which is really important. You kind of need both of those things, yeah? So diagnosis of this is also pretty difficult because there's such broad signs and symptoms. That's what SNS means, signs and symptoms. So it can be kind of hard to diagnose at first. Be like, we don't know why you're having unbalanced walking. They try to do all these tests and can't figure out what it is. Eventually, the ultimate diagnostic tool is an MRI. Anybody know what an MRI is?
Magnetic resonance.
Yeah, it's like a X-ray, but for soft tissues, right? X-rays do bones. MRI does soft tissues, right? And soft tissues don't show up on X-rays, but they will in an MRI. And the MRI will show the scarring in places on the brain, right? Because that's what's happening. The scar tissue is attacking that neuron. Okay, so those will show up as like little splotches on an MRI. And they're like, okay, we see these plaques on the brain. Does that make sense? Again, treatment is going to be really like if they're having a flare-up, they're going to treat them with steroids. And again, try not to be on these for too long because you're likely to get sick. The treatment and prognosis are pretty similar for each of these. Again, more common in women. What is notable about multiple sclerosis is that it's pretty common for them to have like periods of remission where like you're fine and everything's normal, and then you have a relapse and you have an acute flare-up, and that's when you might want to go on a steroid to kind of help with those symptoms. And then it's going to like kind of go back to normal again. It's like these ups and downs that's very characteristic of multiple sclerosis. Okay, did that make sense? I know this one can be kind of weird to wrap your mind around. All right, and this is one that people always get confused. People tend to get multiple sclerosis and myasthenia gravis mixed up, I guess just because they kind of sound similar, I guess, but they're different, okay? So in multiple sclerosis, it's the neurons in the brain that's being attacked. With myasthenia gravis, what's being attacked is the neuromuscular junction. And now it's a fancy word, but it's the place where the neuron meets the muscle. Okay, so neuromuscular junction. Junction means joining, right? So remember I said the neuron is up here, and the tail goes all the way down to the muscle, right? The place where the nerve meets the muscle, that's the neuromuscular junction. So in multiple sclerosis, this is being attacked. In myasthenia gravis, this is being attacked. Does that make sense? So it's similar, but slightly different. And so it has slightly different symptoms. Symptoms is not going to have sensory, though, okay? This is just going to be motor, because it's only affecting where the nerve meets a muscle. Does that make sense? Muscles don't sense things, they just move, right? Like my arm muscle just makes it move. It doesn't sense anything, okay? Does that make sense? So only symptoms are going to be movement. So they're going to have weakness, fatigue, and things like that. So their muscles just going to get really tired. They're going to be weak. You'll start to see like facial droops, because their face muscles just can't like hold it. So like they'll have like, if you see people with like a stroke, for example, like their mouth droops on one side. So stroke is actually one thing that kind of gets confused with this at first. Some of the symptoms kind of look like it might be a stroke just because the face muscles are drooping like that. So in medicine, a lot of it is just ruling out stuff to try and figure out what's going on. Some of these autoimmune diseases, because they can be very vague, are very frustrating to try and diagnose for people, because they're like, I know something's wrong, but they can't give me a reason. And it's often because the symptoms are just very vague and it's very hard to figure out exactly what it is. There is a test for this that's called the Tensilon test. And I won't go into what's involved because it's very complicated. But basically, the Tensilon test, they give you a certain medication. And basically, if after giving you that medication that you immediately have better muscle strength, they're like, all right, we know you have myasthenia gravis now. Okay? So that's all you need to know, is that a positive Tensilon test means they have myasthenia gravis. Okay? So if you see that show up on a chart, Tensilon test, that tells you myasthenia gravis. Okay? For this one, there is this very specific type of drug that's specifically for this, right? You wouldn't use this for any of the other autoimmune diseases. But anticholinesterase drugs, if you see that, that's specific for this one. You wouldn't use this for like lupus, okay? Whereas like steroids you can use for all of them. This is specifically for this one, all right? And this is just a specific kind of that. All right, this one is also progressive and ultimately leads to paralysis, where the muscles just don't work at all anymore and you're just paralyzed. So that's pretty terrible and awful. All right, and that's that for the diseases, okay? That's maybe like half of what's in the textbook, all right? So you don't have to worry about reading the ones that aren't on this PowerPoint. I'm gonna quickly go over some of the meds. And again, you don't need to know how they work or side effects of the meds or any of that stuff. Just be able to identify which disease they go with, okay? Because that's all you really need to know for coding is like, oh, hey, this person's taking this. That helps support this diagnosis, okay? Is that fair? Does that make sense? All right, so DMARDs, these are a class of medications, all right? So it's like an umbrella term, and then there's multiple individual drugs that go under this term. It stands for disease-modifying anti-rheumatic drugs. They might also be called biologics. Those kind of are interchangeable. I don't know why, but it just is. These are two very popular ones, they're very commonly used, methotrexate and hydroxychloroquine. So those are very common. Now, a lot of the other ones, I didn't bother listing all of them because I don't need you to memorize like 700 different drugs. But notice these all end in MAB, okay? oftentimes you don't have to memorize a specific drug, but just remember the endings, because the endings in a lot of classes will have the same ending. So you don't even have to know. You just be like, even if it's something you've never heard of before, and you're like adalimumab, I have no idea what that is. Oh, it ends in mab. I know that's a DMARD. Does that make sense? Yeah.
I'm curious as to why the other two don't. And
They don't always. I wish there was like a committee that all decided like, hey, we're gonna like stick to this rule. But there's always people that break the rule, and it makes me annoyed. But there are a lot of the times that like drugs will stick to that pattern. I think it's probably because these aren't just used for this; they're used for a lot of different things. So they're not just used as, you know how like there's off-label stuff? Like people will take Benadryl to help them sleep, even though it's technically an allergy med. You see what I'm saying? So like a lot of times they'll find out when they give medications that they also do something else. Like there's this medication called Wellbutrin and bupropion. It was originally for depression, but then people found out that it helped them quit smoking. So now it's given to help people quit smoking even if they're not depressed. But it was originally made in the depression class, so it has like the typical depression endings. So it doesn't, does that make sense? Like, so it doesn't always follow that rule. But I'm just trying to point out that if you see a drug that ends in mab that you've never seen before, you can know, okay, I don't have to know anything other than that this is used for that. So I'm trying to teach you tricks how to identify drugs you've never heard of, so you don't always have to look them up, right? So I would just memorize the endings if you can. You notice that, like, okay, mabs are these, and these two as well. These are very, very common, which is why I put them here, because you'll see these a lot. All right, NSAIDs, everybody's got these in their cabinet under their sink, okay? They're just like your typical non-steroidal anti-inflammatory, so ibuprofen, aspirin, you know, someone talked about celecoxib and meloxicam. These are all like those pain relievers, okay? These are very common pain relievers. Most of these you probably already have heard of, ibuprofen, aspirin, Aleve, so that's that. I mean, you can look over those more in detail. All right, corticosteroids, also known as steroids, right? Both interchangeable. Again, these reduce inflammation by weakening your immune system. Okay, so very helpful for autoimmune diseases. Also remember that they can, if you're on them a long time, you might be more likely to get sick. Okay, so that's a big thing to know. What do we notice about the endings for corticosteroids?
So,
And then
Yep, they end in own or sown, some kind of own, right? So if you're just trying to be like, oh, I have to memorize these, like, not really, just memorize that they end in own, right? Fluticasone, I'm sure you've all heard of Flonase.
yeah, that's the
Yeah.
one.
That's a corticosteroid, okay? You probably heard of hydrocortisone. That cream that you put on your skin, that's a steroid, okay? So they end in zone, lone, whatever. It makes it a lot easier to memorize than having to just memorize a list of drugs, okay? All right, here's the heart thing I mentioned. Who remembers what heart is for?
you said it's like a cocktail of antivirals.
Yep, for people with AIDS, right?
Yeah.
So there's, this one was very hard to try and consolidate because there's just so many. I was like, I don't even know how to consolidate this. But you'll notice that a lot of them end with vir, okay? And that should help because it's virus, right? Antivirus. So if it ends with vir, it's against viruses. These are also really common. These are, you probably see commercials of it. Who ever heard of Biktarvy? I know I've seen commercials for that. So these are like these are like the name brands, you know, and I didn't put like the long medical name for it because these are combination pills. So Biktarvy probably has like 5 different meds in it, okay? So I'm just putting these here because they're very common and you'll see them. So these are all the drug classes that are part of heart, right? So like these aren't individual drugs, these are drug classes with multiple drugs underneath them. That's why I was like, it's very hard for me to like figure out how to consolidate this without having you guys memorize 5 million of them. So I just put these here so you can notice the vir, and then these are very common single pills that have multiple drugs inside of them. Does that make sense? So Biktarvy has like maybe this one, and this one all inside, okay? And I just put these drug classes here because if you see like this listed, you can know that those are for AIDS without having to memorize every single drug that's in that because that would be a lot. All right, this one, and remember this is specifically for which disease? Talked about it right at the end. Anticholinesterase drugs. Okay. So that's, most of the drugs are interchangeable for autoimmune diseases. You would not give this to like someone with lupus, okay? It's specifically for this, okay? So anticholinesterase drugs, these end in -ine, but these are, you'll pretty much only see these. These are like the most common ones. Pyridostigmine and neostigmine, these are helping with those people. All right, and that's all I expect you guys to know for medications. Last semester they had to read an entire book and do all these assignments. It was ridiculous. I didn't create that curriculum, so I got rid of that. So I tried my best to make it as reasonable as possible. All right, if you have questions, feel free. We're coming here towards the end here. I think I have just enough time. You guys can go ahead and open up your quiz. It's on eLearn. Anybody not have a computer?
I didn't know to bring them.
You can use the computer in there. There's computers in the little waiting room. Let me turn this off.